cases has risen to 252, and that's based on 19 cases that have been received in the last 24 hours. 9 of these, which we just received, we will provide additional information on in terms of male-female split, but 10 we received earlier today. Of that 10, 2 are males and 8 are females, with ages ranging from 20 years to 50 years. 7 are associated with the workplace cluster. 2 cases are contacts of confirmed cases, and 1 case, this is of the 10, is under investigation. There are now 131 confirmed COVID-19 cases related to that particular workplace cluster. Their ages range from 18 to 52 years, including 104 females and 27 males. They are primarily from the parishes of St. Catherine and Kingston and St. Andrew. In terms of the case classifications, there are now 34 imported cases, 53 contacts of a confirmed case, 8 that are local transmission with no epidemiological link, and 148 that are under investigation. Of that 148, as said earlier, 131 have been identified within a workplace cluster. In terms of testing, yesterday we commissioned the Cobas 6800 machine. Training of staff has also been completed, and the facility is now able to complement the work done at the National Influenza Center, with the capacity to test approximately 380 samples per 8-hour shift. And if we do 2 shifts, then it's double that. We do have the capacity to do 3, which would take us over 1,000 for that particular machine. And this is a major development for us, because it means it has significantly expanded our capacity to test. The real challenge now is to ensure that we get the samples to be tested, and that involves a different set of variables which we have worked on, are working on, with the latest addition being, of course, the 5 mobile units that were added and deployed last week. So far, 2,125 samples have been tested. 252 are positive, 1,872 are negative, and there's 1 pending. We expect to test quite a number of samples over the next 24 hours. We can elaborate more on that later on, but given the new addition, which has now demonstrated its capacity to function accurately, we should see quite a few hundred of samples being tested over the next 24 hours, which could or may adjust the numbers in terms of positive tests. There are 230 persons in terms of isolation, quarantine, and recoveries. 230 persons in isolation, 71 in quarantine in a government facility, 814 in home quarantine in St. Catherine related to a workplace cluster, 31 in home quarantine in Portland, and this is based on contacts of confirmed cases, and 28 persons have been recovered, to date. 6 persons, unfortunately, have tragically passed or died. So we are making contacts in our progress in terms of recovery, 28 persons, and as you would imagine, the number of persons in isolation and quarantine have grown substantially for a number of reasons, and I really want to just salute and recognize the efforts of our medical team, including those in the field doing the contact tracing, those managing the quarantining and isolation facilities. That burden, that part of the challenge is getting significantly more stressful, more engaging, requiring a lot more attention. And later on this evening, after we have given this update and done one or two other things, we're going to be engaging in the digital town hall type discussion around community transmission and contact tracing. We believe that needs to appreciate and understand what it involves, but also, very importantly, the role of the team on the ground and the role of the public, each citizen, if they were to be approached and requested of them information or participation and involvement in this exercise. It really is a case of everyone counting, and as we move into the phase of community transmission, it's going to require more from the public and control the COVID-19 public health threat. So in terms of contact tracing, the health department across the island are currently tracing approximately 1,409 close contacts of confirmed cases. That's 1,409 close contacts of confirmed cases. So in addition to the hundreds that are in quarantine or isolation, whether home or institution, the team are in the field every day seeking to identify and follow up with and to interrogate and to test and to collect samples of 1,409 Jamaicans. And that number is a moving target. It increases each hour depending on the information and depending on the next confirmed case. And again, I think it's important that the public appreciates and understands that because their input, their participation is so important. In terms of the Ministry of Health and Wellness, you would have heard that a number of our staff members have confirmed positive based on over the last few days. I believe it is now 6 individuals. Is concerning to us at the Ministry of Health and Wellness, but in a sense it is expected because of the higher level of risk that public health workers have to face in being on the front line and carrying this fight to overcome this public health threat. In other words, if you look at every country in the world faced with major public health threats, it is the people on the front line, the public health officers, the doctors, the nurses, the contact tracers, the community public health staff. They are the ones who have to interact with persons who are vulnerable, who are affected, and even with the precautions that we insist on them taking, and even when they take the precautions, there's always a margin of error. There's always the possibility, putting on the garb, taking it off, disposing of it, talking to someone who they may not have been aware was affected. There's always the risk that they would be, public health personnel would be in a position at a higher risk to be affected. And so we certainly regret what has happened, and we will do all that is necessary to ensure that they be given absolute care and support, themselves, their family members, their close contacts, because frankly speaking, without them, the leadership in overcoming COVID could be significantly compromised. And so we have to ensure that they are given all the support that is required to ensure that the motivation continues and that we all continue to move the process forward. So we continue to be concerned and continue to respond to this situation. And we have done so. Sanitization exercise has been completed in all buildings that, having done the investigations, are identified with these individuals who have tested positive. Counseling for staff members as necessary. Contact tracing at the head office has commenced, and some members of staff have been appropriately notified. Some have been placed in home quarantine and given additional information and follow-up action based on their role and based on the that they have come in touch with that may be affected. Today, over 100 additional samples were collected from staff members, and this sampling exercise will continue into tomorrow. So we're doing a lot of testing also of the Ministry of Health personnel, even where we feel the risk is minimal. We're not taking any chances because we want them to be given the reassurance in the first instance, but certainly also to the extent that we need to contain any possibility of spread. It is important that we do so again, because these are the operatives in the field. We need them, and we have to give them full and maximum support. We are in the process of developing a circulating to our key stakeholders a staff welfare protocol that speaks to the care of team members, including those on the front line who may be vulnerable to COVID-19. So even at the start of this process, there was appropriate guidelines that were provided, but it's something that you revise as you go along. This is a novel virus. It has particular features, and as you go along, you reassess, you adjust. And given the current scenario with the positive cases, we have made a few adjustments to enhance the approach that the frontline staff, members in the field, those who are coordinating the activities, are adequately given the support and the protection that they deserve and that they need. In terms of the public appeal, I want to just use the opportunity again on behalf of the members here at Ministry of Health and Wellness that we need to recognize that we all have a role to play. Now, this is like a stock record. The Honorable Prime Minister has said it over and over again in his public pronouncements, whether in the Parliament or at the press conferences at Jamaica House. We have said it. We have mainstream media saying it. We have community communications, whether it is town criers or otherwise doing the same. It is so important that the public recognizes that they have a critical role to play and that they follow the guidelines that are outlined. So the staying at home, avoiding crowds, the frequency of washing and sanitizing hands, the wearing of masks in public, all of these are so critical as we seek to manage and overcome this critical, very important public health threat that we face. You are also urged, of course, to cover your mouths and noses if sick or when in public, and that, of course, represents the wearing of masks. The challenge with COVID-19 to date, in terms of our local experience, is that we have been able to manage, I think, and tribute to the public health officials, the process where we have focused heavily and achieved some success in containment to minimize the impact of community spread coming too early because of the impact and the consequences it would have on our hospital services, or beds, or doctors, or nurses. The truth is, if we had an explosion of cases that required hospital care too early, then the capacity of our public health services to cope would be very difficult. And indeed, I say, almost impossible. You just need to look at other countries where there are surges, where patients cannot get ventilators, cannot get hospital beds, even in some very developed countries. And so the plan has always been to use restrictions to minimize, in the first instance, imported cases, contain through contact tracing, through quarantining and isolation, the threat that may present itself in terms of potential cases, and to use that time to enhance the public health infrastructure in order to deal with what would have been an inevitable scenario given the nature of this virus, where it becomes more widespread across the country in terms of people picking up the virus from others and not even knowing that they have it because they may be asymptomatic and not knowing where it has come from, as is the case with earlier cases where we have a travel history that's linked to the virus. That phase is called community transmission or community spread. And we want the Jamaican people to begin to start adjusting their minds to what community transmission and community spread is and what the implications are for them, for us in public health, what their role needs to be, and what are some of the adjustments and changes that are going to be necessary when we declare that we are now in community spread, because it's a different management mechanism that has to be put in place. I'll give you one example, and I'm running ahead of the digital discussion which will take place after this, but the idea of hospitalization versus home care is something that we're going to have to come to terms with, because the reality is not all infected persons are going to be required or can be afforded a hospital bed. And the question is, what does it mean for you to have COVID-19 and told to stay home until you get better? And the dynamics of that are important to appreciate and understand. So that is to come in terms of a discussion that will take place after. But ladies and gentlemen, if we are to beat COVID-19, it is now more important than ever, as we continue to say, to recognize that everyone counts, and that, as is being said, you must stand on your yard. Very, very important, and keep your distance. It's critical that we all play our part. I know the situation can be overwhelming. I know it's important that it's unusual. It represents almost a new normal. The restrictions are difficult for persons who are accustomed to moving around. Economic activity is contained, and it does require some sacrifice. But the truth is, this is sacrifice in the interests of each other, your family members, your community, and indeed your country. So that represents our update for today. I've given the numbers: 252 cases, 19 new cases in the last 24 hours, and of that number, a fairly significant amount, 131 cases are linked to a workplace cluster. And of course, we all know by now where that workplace cluster is, and there are some arrangements being made to try and contain that particular issue. At this time, and before the questions, we allow the media to, I want to just recognize the Honorable Minister Favour Williams and the Universal Service Fund CEO, Mr. Daniel Dawes, who are here with us. And Minister Williams is making, on behalf of the Universal Service Fund, a contribution to the COVID-19 efforts. And I'm going to allow her to just speak for a few minutes. Minister Williams, could you just come right here for a few minutes and just hand over that contribution, and then we go right into the questions from media personnel. Minister Williams, how are you?
So good afternoon, everyone. I am pleased this afternoon to be here at the Ministry of Health and Wellness, and pleased that the Universal Service Fund has joined the national fight against the COVID-19 pandemic by providing Jamaican $17.5 million in information and communication technology support to the Ministry of Health and Wellness. As you are aware, the agency, Universal Service Fund, falls in the portfolio of the Ministry of Science, Energy and Technology. It has upgraded the bandwidth speeds of 59 health facilities across the country. The beneficiaries include health departments and centers, regional offices, and hospitals. The upgraded connectivity is to facilitate an uptick in demand for connectivity by the Ministry of Health, particularly through video conferencing, data transfer, and archiving activities during the national response to the coronavirus. The additional bandwidth will also enable healthcare providers to engage in telemedicine, teletriage, and virtual clinics. The provision of the additional bandwidth is in keeping with the Ministry's mandate through its departments and agencies to leverage internet connectivity for the public good. This pandemic, as we all know, will require all hands on deck. Now more than ever, we have seen the power of internet connectivity in keeping stakeholders informed, facilitating communication among colleagues, and enabling research. With this increased connectivity, the Health and Wellness will be better able to fight the pandemic. The arrangement for increased bandwidth has been made for 7 months, with an assessment of the service to be made after the 4th month to determine if additional service is still required. We have here with us this afternoon the Chief Executive Officer of the USF, Mr. Daniel Dawes. And from him, he told me that this recent initiative is the latest example of Universal Service Fund support to the health sector. Earlier this year, he reminded me that the USF upgraded the internet connectivity at facilities across the Ministry of Health and Wellness, and that last year, the USF handed over a $32 million infectious disease surveillance system to the University Hospital of the West Indies. He also notes that the USF stands ready and willing to provide technological support across all sectors. And as a reminder, the Universal Service Fund was established in 2005 and is mandated to ensure Jamaicans from all walks of life have access to the internet in a bid to ensure the country becomes a digital society and a knowledge-based economy. Thank you.
Thank you very much, Minister Williams. And on behalf of the Ministry of Health and Wellness, really want to say a big thank you to the joint-up approach to this COVID fight. These resources will be very useful because, as you know, this fight is a national one and we have to reach right across the country. So the bandwidth and greater reach and data transmission is absolutely critical. All right, so I believe we're going to do a, is it back here? Yeah, a quick over. Okay. Thank you very much again to the Universal Service Fund and the Honourable Minister Favour Williams, Mr. Daniel Dawes, on behalf of the Ministry of Health and Wellness and by extension the people of Jamaica. We can move now into the questions.
We invite the members of the media just to a reminder to use the raise hand feature in the Zoom to ask your questions. And we're going to start with Dion Jackson Miller.
Thank you so much. Dr. Tufton, I know you met with the Mayor of Portmore last Tuesday, but both the Mayor of Portmore and the Mayor of Spanish Town have said they were unable to reach you after, or the Prime Minister, after lockdown started last week. And the Portmore Mayor on Monday, the Mayor of Spanish Town yesterday. How is it that you could have locked down an entire parish and the mayors not be an integral part of your team? Second question, have the technocrats been recommending or have they recommended full national lockdown? And 3, we're seeing reports overseas of critically ill COVID patients being saved by ECMO machines. How many such machines do we have in Jamaica, and are they a part of our response plan? Thank you.
Okay, thank you very much. I will take the mayor question, and then I'll ask the CMO to deal with the clinical one, the techno machine, which I wouldn't be in a position to give much information on. Yes, I did. Sorry? ECMO. Okay. All right. So I did meet with the mayor of Portmore because of clearly the issue involved the city of Portmore. The facility is located in Portmore. I met with him. I left a meeting that was discussing the issue in Kingston and drove over, called him up, drove over and met with him in his office. He had one other counselor with him. I could not give him a lot of details, but I did share with him the concern and the findings that the public health team had come up with, and indicated to him that some strong while I could not give him all the details, because at the time the decision was still pending, I thought it was necessary to give him enough details to recognize that we had to do something in the public health interests of the residents of Portmore, of the municipality. He was aware of some of the issues, and so I benefited from the discussion, because he, clearly being the mayor, would have been in a position to outline some of the concerns he had. He had indicated he had visited the facility and others, and I benefited from some of that conversation. The decision to shut down came after the final decision, and the terms or conditions of that shutdown. Clearly, it's a collective decision, and I share in that. And subsequent to that, I had a phone conversation with him, but that would have been a few days after. So I did not speak to the mayor of Spanish Town, but I did speak with the municipality because of the immediacy of the environment where the location was and the impact of Portmore in particular. Maybe one could say it's an oversight not to have spoken to the Spanish Town mayor, but that's what happened. I'm just laying it out as it was. The last conversation I had with the mayor, I had committed to have another conversation with him. I have not been able to have that as yet because of so many things that have been happening, but I intend to follow up and to expand on the discussion as it relates to some of the things that we're doing in the parish, and in particular in Portmore. As it relates to the discussion around total lockdown versus partial lockdown, you know, it's not customary to indicate what advice is given to the policymakers by technocrats. As far as I am concerned, decisions are taken by the policymakers and the executive arm of government, and it is influenced by the advice given by the technocrats. And it's advice that we take very seriously, and then bring that advice to bear on all the other issues. So what I'm prepared to say is that a decision was taken, which you're very aware of, that was influenced by the advice of the technocrats. I am not in a position, or would not put myself in a position, to start telling you what the technocrats said versus what the policymakers said, because to me, that would be unusual and would be a recipe for confusion. So I'd prefer not to comment on that, but just to say the government took a decision influenced by the technocrats, and we tweak the decision as we go along, because the reality is, Dion, these are unusual times, and there is no playbook that is written to prescribe an approach as it relates to this particular situation and the context in which it has to occur. So the government is always flexible, but the government always makes a decision based on what it thinks it is right for the people, and it is always an issue of how you balance all the considerations. And I think that's what we have done as a government. And again, are always available to make changes, as we have done since the first decision was taken.
Just a quick follow-up, if I could, before the CMO comes in, though, just in relation to your response, because you're speaking about calling the mayors, informing them, and so on. And my question was, why aren't they part of the team, because you have locked down an entire parish? How is it that they are not part of the discussion in terms of how to manage the logistics in the parish?
Right. Well, I wouldn't say that they're not part of the discussion. I mean, the mayors primarily relate to the Ministry of Local Government and Community Development. The Minister of Local Government and Community Development is an integral part of the discussion and the conversations, Minister Mackenzie. And so, you know, he is very involved in dealing with the issues of local government participation. Indeed, the Office of Disaster Preparedness and Emergency Management, the Secretariat, is falls within the Ministry of Local Government and Community Development. I have been on many discussions with Minister Mackenzie, not just at the level of cabinet or sub-cabinet, but also in a Zoom meeting with all the mayors across the country. So I think it would not be accurate to say that the mayors are not involved. But as it relates to the role of, in addition to that, I may add, in addition to that, the parish health officers and the head of the parish health, Prosper Chen, the medical officer of health of St. Catherine, as I understand it, has also been in touch and in dialogue with the local municipal council in terms of updates and so on. So it's not just about me as minister, it's also about the team and how they relate. And they have been in touch, they have communicated, and I believe also the Minister of Local Government and Community Development. I'm going to ask the CMO to answer the third question you asked.
Hi, good evening, everyone. Thank you for your question. So, extracorporeal membrane oxygenation, or ECMO, is a procedure where essentially it's almost like to the lungs, what you do to the lungs that you would do for the kidneys in dialysis, in that you shunt blood through an artificial lung system in order to promote oxygenation of the tissue while the lung is healing, especially in this kind of system, in this kind of disease process where we have damage to the lungs. So it is a therapy that is being considered and more in the management of patients with COVID. We do have that facility available at the University Hospital of the West Indies. I cannot say if we have had cases from my own understanding and knowledge of the management of the cases so far. We have not had cases where we have considered the use of that therapy. However, it is available. It is not something that is available elsewhere in the island. However, I do want persons to realize that having a machine or a system is one thing, but also having the personnel to support it and all the other necessary laboratory and other support that is needed. We do not have all of those facilities right across the island, and so therefore that kind of very technical, more advanced therapy and treatments, not only with ECMO but with other things, would be available at institutions like the University Hospital of the West Indies.
Thank you very much, CMO. We're going to go now to Brittany Clark from Nationwide.
Yes, good evening. Thank you. All right, so I have two quick questions. The first There have been comments by Prime Minister Holness as well as Foreign Affairs Minister Camilla Johnson-Smith about the controlled re-entry of Jamaicans who are overseas and wish to return home. Now, Minister, how far are we in identifying places or facilities to facilitate the quarantine of these persons? As well as I also gather that there is some discussion ongoing within the government space about the return or surrounding some Jamaicans who are in Antigua. What can you tell us about that? And my second question, what are the issues to be resolved in not getting enough samples so that we can significantly ramp up testing, given that we have increased our testing capacity, as well as how will the newly commissioned Gov't 6800 machine be used to facilitate this process? Thank you.
Okay, you are a little muffled there for a little bit, but let me try to appreciate what you said and respond to the extent that I understand. The issue of persons coming back into the island and of course therefore requiring adjustments in the restrictions. It is a real issue, and it is an issue that we have considered. As you will know, yesterday we received a number of persons who have been returned by the U.S. authorities to Jamaicans, and we have appropriately placed them in a facility which effectively is quarantining them, and it is a joint effort between ourselves and the Ministry of National Security. Our role in this as public health is to ensure that these individuals are observed appropriately and so that when they are released in the general population, they are not bringing in the virus. So all the protocols related to quarantining would apply, but it's substantially an operation driven by the Ministry of National Security. The same would apply in terms of other special groups that may come in. The general principle is to use the protocols that we have established in public health to secure the health status of those individuals so that when they are released, they are appropriately not a threat to the population. I would prefer not to comment on specific groups because the details of the handling of these groups are dealt with by in the Ministry of Foreign Affairs, Foreign Trade, and the particular ministry that may be related to what that group represents. I would allow you to ask that question when the Prime Minister speaks and the other ministers are present who can give details on specific groups. But just to say in very general terms and with a focus on public health, which is what we represent, we are working on a plan that clearly would be subject to discussion and approval at the level of cabinet that would see a managed approach to re-entry of Jamaican citizens. It's not just about public health, it's about many other aspects of government. As you know, border control and protection is a national security issue. There is foreign affairs. There are other elements to the plan, but our primary function is to manage re-entry in a way that public health's input ensures that we minimize the risks to the country while giving or guaranteeing the rights of Jamaicans to come to their country. And in short order, we should be completing a plan that clearly would be subject to scrutiny and discussion, and additional information and input, which ultimately will lead to that becoming more standard than exceptional. So in the meantime, yes, we are working with the other ministries to ensure that we do what is necessary from a public health standpoint, and you would have witnessed at least one incident of that yesterday with the persons who have come in. I don't have a lot of details on any other group at this point in time. Thank you. The other question was?
Yes, the other question was what are the issues to be resolved in not getting enough samples? I remember
oh, samples, okay.
And how will the newly commissioned Gov't 6800 machine facilitate the process?
Well, the Cobus machine is going to facilitate by allowing us to test the samples. Okay, but the getting of the samples, I mean, we do have a sampling strategy that is based on testing our suspected cases, testing the contacts of the confirmed cases, and of course our island-wide surveillance of any kind of respiratory cases, whether it is those that are admitted, whether it is those that present themselves to our health facilities, our accident and emergency departments, or our primary care centers. So we do have that testing strategy is expected to yield upwards of 1,000 cases per week. And if we continue to have the number of confirmed cases that are going up, even if it is that it is not, we expect that we are going to have a drop after we have dealt with the call center issue, but we still are going to be seeing an increase in the number of cases. And so by virtue of that, the number of contacts increases that we test. So we don't expect that we would have a problem in continuing to get the number of cases. But of course, this kind of strategy in testing is designed to pick up the cases so that we are going where we expect positive cases to be.
Thank you very much, CMO. We're going to go to the Gleaner. Can the representative identify him or herself? The person from the Gleaner. All right, we're going to go to Emma Lewis.
Yes. I'm on birthday, and I just wanted to ask a bit more about the health on behalf of the healthcare workers. How many of them are being tested? Are they being tested regularly? And what is the situation regarding PEP, the protective gear for the health workers? Forgive me if you've already informed us of this, but I just want an update also on how the mobile units are being deployed for testing, how and where, and who are they testing? Thanks.
Okay. All right. So far, I don't have the total number of healthcare workers that have been tested so far, but we have been testing right across the island. We test different groups. We test the persons, of course, who have illnesses. So all our healthcare workers who develop any kind of respiratory illness or flu-like illnesses are tested. In addition to that, we have the testing of the exposed healthcare worker. And so there is an assessment tool that is used. And so for persons who are exposed, whether it be low risk or high risk, there is a protocol in place which involves the testing of the worker to see what is happening and how it is that we continue monitoring and management of the case. So out of that, so far we have had 3 healthcare workers from the field that have tested positive, and we have, in addition to that, we have the 7 persons from the Ministry of Health and Wellness head office that have tested positive. All of these persons are doing quite well, and we continue to monitor them on a daily basis. We have 2 persons that are in 3 that are facilities right now. We actually have 4 persons, that are in facilities right now, and they are doing well. We had 1 person that was moderately ill and that has improved quite significantly and is doing very well.
All right, thank you so much, CMO. One of the questions from the Gleaner would have been, has the ministry commissioned any research into a vaccine for COVID-19?
Maybe Dr. Webster Carr wants to take that, or epidemiologist.
The simple answer, no. We haven't.
All right, thank you so much. We're going to go to Owen Brown from Roots as we take our final sets of questions.
Recognize?
Let's go ahead, please.
Yes, right. I wanted to ask a question regarding the test for persons rather who came in between March 18. I know that the CMO said that it has been reduced significantly, but what's the status of the persons, of the 1,000 plus persons that basically said that they're going to contact the ministry? What's the status on those persons? If they have called in, if they have been tested? And regarding the mobile application that was being developed, soon will that be, in the public, and persons can actually use it if they want to get tested?
Okay, in terms of the monitoring of the persons that have that had entered the island during that period of March the 18th to March the 24th, we have various scenarios. The majority of those persons would have completed a 14-day period, which would have been the incubation period of the virus, and would have remained well, would have been asymptomatic during that period, and would have remained at the end of that period. We have many of those persons who would have called into the health departments or through the hotlines who would have had testing done. Out of that, I don't have the exact number, but I can recall offhand 2 persons that we would have picked up as being positive cases that would have come through that call-in system, and then they would have been directed to the health department, would have been tested and have found positive, and would have been placed in facilities. We would have had also of those persons a significant amount of persons who their names would have been sent to the parishes in which they reside, and the parish health departments would have been following them up, doing daily monitoring. That has worked extremely well in some parishes more than others, but I'm very pleased with the response of the health departments in managing that. They have been following up those cases, and I know of, again, 2 cases that were picked up through that monitoring of persons and recognizing a variation in their temperature that resulted in them being tested and then being found to be positive and being isolated in hospital. So all in all, we have had some cases that we have picked up some positives from, and those were managed accordingly. The vast majority of persons would have completed their period of observation and have remained well.
All right, thank you very much, CMO, and we thank all the members of the media for their questions. Regrettably, we couldn't get to all of them because we want to transition now into our discussion around community transmission and contact tracing. Minister?
Okay, thank you very much, Stephen. So, ladies and gentlemen listening on, the issue of community transmission is one that we think needs to be ventilated and to hopefully generate greater levels of sensitivity and understanding by the general population. And it's important for a number of reasons. So over the next minutes or few minutes, we're going to spend some time explaining what community transmission is, what it means for us as public health, what it means for the population. We want to look at contact tracing, another very popular terminology used. What is contact tracing? How are people involved in that public level? At the community level, what are the actions that have to be taken? We're also going to speak with someone who is involved in public health, who is involved in contact tracing. We'll have her on the phone to help us to share her experience as it relates to that activity. And we have a positive asymptomatic patient who will also share her experience. So she is positive with COVID. She is in an isolation facility somewhere in Jamaica, and she has agreed to come on to explain her experience and to let us get an understanding of what an asymptomatic situation is like in terms of a patient. This is important because community spread could mean patients who are not as ill to require hospital care and therefore would have to be staying at home and isolating in order to get well. I'm going to ask to start us off our epidemiologist, Dr. Webster Carr, to explain in her words and based on her experience the concept of community transmission and the phases that we're going through and why this may be the next phase.
Thank you, Minister. So within this outbreak, there are 4 different phases. So there's no cases. We changed no cases. It's called sporadic cases, just a few cases, which are likely to be imported cases. And then we have clusters of cases. That's where we have persons who are linked to each other. So you got the infection from a known person, and that is cluster. So they're probably in a geographic area together, or they went to an event together. The next phase is called community transmission, and this is a phase that we are staring down at. This is when there's a large number of cases that are not linkable to other cases. And there will be multiple unrelated clusters. So persons we've seen coming up and they are not related. And then we'll be picking up more and more persons through our regular surveillance system, such as what was described by the CMO before, where persons with respiratory symptoms, whether admitted to hospital, we would see that increasing. So it's spreading generally in the public. It means then that persons can get the infection if they are in contact with other persons, and likely it is unknown whether they are positive or not. And so the importance of ensuring that we do the public health intervention of staying at home, keeping our distance, and hand washing, hand hygiene. And if you're sick, stay at home because you may be spreading it. And even while you're at home, if you're not sick, for instance, if you have an older person at home and you are the one who goes out, when you come back home, you are to ensure that you wash, as well as it may be useful for you to wear a mask to protect your older relatives.
Okay, so we have online, thank you, Dr. Webster Carr, we have online a nurse, a public health nurse, and she is very involved on the ground in contact tracing. And we invited her to come on. She has graciously agreed. And I wanted to just ask her to help us to understand her experience as a contact tracer, what it involves, how do you prepare for it, how do you approach persons, what questions do you ask, and how do you protect yourself, and what happens if you actually come in contact with someone who you suspect may be positive. Nurse, are you on?
Yes, sir, I'm on.
Okay, great.
Good evening, everyone.
Good evening to you, and thanks a lot for joining us. So tell us a little about what, in your own using simple words so everybody can understand, what is contact tracing from your perspective?
Okay, from my perspective, I would say contact tracing in public health is a detective work. What we actually do, we find the index case of the person who is infected with a disease, and in this case, we are referring to COVID-19. Then we ask the person for the names of all the persons he or she may have come in contact with during that period. And we ascertain from that individual the duration of the time, whether they had maintained the 3 to 6 feet distance, how long they spoke with the person. And when we get that information, we get name, addresses, telephone numbers of those persons. then we go ahead and we call all of these persons and we do what we call a double back checking. So the same questions we ask the index case is the same questions we ask the other persons who may have come in contact with the index case. So, for example, we would ask, when you spoke with the person, you were in a ventilated room, was the AC on, was the window open, were you in an open space, were you sitting close beside the person, was the person wearing a mask when you spoke with them? Those are the sort of questions we ask. The purpose of this now is to trace all the persons who may have come in contact and therefore is at risk for getting COVID-19. Then from there, we move on and we create a database and we trace those persons and we call them twice per day and we do temperature check. Initially, we would visit their homes, we give them thermometers and we give them what is called a log sheet for them to check their temperature every morning and every evening. On it, we also have the respiratory symptoms where we ask them, do you have any fever, any cough, any vomiting, any diarrhea, any of those symptoms we ask. A list of symptoms are there, and we follow those questions, and we ask, and we log. As soon as one of the persons who may have been a contact of the index case comes up with a fever, we escalate. So that is reported to the parish health department, to the quarantine area, and the persons are contacted and arrangements are made to pick up those persons.
That's a really good explanation, nurse. So let me ask you, and just to clarify for the listening public, the index case is someone who is positive.
Positive, yes.
So you have an individual turns up at the hospital, tested positive for COVID. It immediately triggers that person. So you sit with the person, you say, okay, where do you live? Who do you live with? Who are the persons you have come in contact with over the last how many days?
14 days.
14 days. And that could be, I'm going to ask you approximately how many, having done that kind of interview, how many persons you could potentially link to that original person, and therefore give us an idea of how many people you may have to visit.
We are looking at a minimum of 20 persons. If, for example, this is a person who takes public transport, or it may be somebody work in an open space, for example, somebody who sells, the number will skyrocket, so we might be looking even at 40, 50 persons that we now need to locate.
So basically, you could actually, from one person, need to speak with your team, that is 50 persons, 20 to 50.
Sir.
And
yes, sir.
How do you manage that? How many members of you in a team to sort of get to that kind of level of contact with all of these persons?
Well, the team is led by the parish SMOH, Dr. Heather Reed-Jones, and from there, what we do every morning, we have a briefing. Every evening, we have a briefing at the parish health department, and it is led by her. What we do, we look at the cases, and we assign different persons, whether it be the public health nurse, the public health inspector, the community health aide, and we form a team and we isolate persons. So, for example, if we have 4 persons in the Kingston 2 area, 3 in the Kingston 5 area, we send teams into the different areas to interview these persons, to give them thermometers, show them how to use the thermometers, give them log sheet, give them their quarantine order, and we call them every day. Now, we designate different public health nurses to do the call out in the day and in the evening. So we have a listing, and the individuals are called, and we ask them, what is your temperature what was your temperature this morning? What is your temperature this evening? And all of the clients have a log sheet at the health department, and we record this information. Then we ask them any cough, any cold, any runny nose, and we log all of those respiratory symptoms as well.
Let me ask you something, nurse. Given that, let's say you have 40 persons that are linked to the index case or the positive case, what about the persons that those 40 persons came in contact with?
We
do
also
you
do
probe
that as
beyond
well,
that?
sir.
Sorry, go ahead.
Yes, sir. We go beyond that. So, for example, Miss Jane is the index case, and Miss Jane might have Mr. Brown as one of her contacts. Then we would ask Mr. Brown, where have you been for the last 14 days? So we are sort of doing the domino. So we are trying to find all the other sub-contacts, as we call them, of the index case.
But nurse, that could mean you could get into the hundreds.
Yes, sir, definitely, or the thousands.
Wow, I think Jamaica needs to appreciate and understand the task that is involved in moving. Now, let me ask you, what is the response generally of persons when you approach them? Are they willing? Do you get a lot of pushback? Do you get people not wanting to cooperate, running away and hiding? I mean, what's the kind of, what's the response to you as a nurse going out into the field?
It is very challenging because of the stigma that is associated with this disease. So, for example, a few days ago, Monday, we went out and we tried to find some persons. We went to the home of one of the contacts, and we were told that she's not living there. So we keep asking and we asked. We found a grandmother to the grandmother of the person. We gave her the number and we asked her to call the grandmother and asked the grandmother to tell her granddaughter to call us. So you can imagine how intricate that becomes. Then the person called us and she said she gave that address because she doesn't want anybody to know that she is being sought out by the Ministry of Health because they will discriminate against her. They might burn down her house. And she had a lot of challenges. So what we had to do was to identify an open space that is known to her and ourselves. And we met her there and we did the interview and we gave her thermometer.
So basically,
so the concern we have, sir, is the discrimination that is out there. It is real and persons are afraid. When we go into some communities, persons will say, when you have COVID, it's who to come for, that sort of a thing.
Right, so once they learn that your Ministry of Health, it's about COVID, and
it is about COVID.
People are running and dodging and hiding because they don't want to be identified. Tell me, nurse, how many hours do you have to spend doing this? I mean, in a typical day, it sounds to me that you could be at this for a long time.
Sometimes we go 8 hours, sometimes 12 hours, because currently we have persons on the field searching for persons.
So it is a lot, eh?
It is a lot, and we do it every day, including the weekend. Both holidays that just went by, we were out in the field trying to find persons.
And you have to literally neglect everything else just to focus on this as part of your, to get the job done.
We have to, sir.
Let me ask you another question, and I'm going to leave you shortly. I really appreciate your agreeing to do this. Ladies and gentlemen, we do this because I think the public, I tell the team here that I have to get the public to appreciate and understand what the public health team has to do, what they are doing, the burden on them, and why it is that all have to cooperate and give them the full support as we tackle this issue. Nurse, in terms of your own safety when you carry out this responsibility, clearly, if you're doing an interview with a contact, you place yourself, that contact is potentially contaminated.
Yes,
that's why you are talking to them in the first place. How do you protect yourself, and how does your team protect themselves in terms of their dress, their approach, their discussion, distancing, all of that? Is there a protocol for that?
Yes, sir, there is a protocol. What we ensure that we do, we maintain most times what we do when we go out, we use a marker. It might be a stone, a simple stone. You put the stone on the ground and we say, do not pass stone. So we ensure that the person doesn't pass the stone. We do wear masks, we do wear our face shield, we do wear our PPEs in general.
Okay. So basically you have to establish some rules. So you need
rules.
you need cooperation then. In other words, if you don't get the
Yes.
cooperation, those rules are difficult to abide by.
Yes, sir.
All right.
So what we do not allow the patient, potential patient, to outline the rule. We make the rule. We say, remember, we must maintain, so we are using this stone. Do not pass this stone. Or we might put a piece of board there and we say, do not pass this board. And if we see them coming beyond the board, we just nicely say to them, please remember that you are to maintain the distance, and we speak with them from there.
And the final question I want to ask you is, in terms of a recommendation, let's say you do contact tracing of a patient, and patient, based on your report, demonstrates symptoms, and you think that they may be positive or they need testing. How do you approach that? Because coupled with the discrimination and other things, what do you use? What techniques or approach do you use to get those persons now to come in at least to do testing or to be quarantined?
Okay, well, the persons who are positive, the MOH, that's the medical officer of health, are the individuals who normally communicate these positive results to these clients, and there are specific guidelines that are used and protocols in the management. We do not allow the positive clients to come to us. We educate them that they are to put on a mask, pack a bag, remain where you are, and we usually send an unmarked vehicle to pick them up.
I did say the last question, but I have one final one because I think we
That
need
is
to.
fine, sir.
And I appreciate the time that you're taking, and I find it rather fascinating, and I hope the public does too. The assessment of a home, because if we're moving into community transmission, one of the decisions that we're going to have to take is that persons who are positive but are not requiring hospital care will be asked to stay at home. But at the same time, we don't want them to be transmitting the disease while they're at home. Does your assessment also include assessing the home environment so you can make a recommendation to say you are positive, or if that person is positive, you're going to have to stay in this room, use this bathroom. These are the circumstances in which your mother, brother, or husband can come into that room. How do you prepare the whole situation for isolation and or quarantining and isolation?
Okay, then, Minister, what we do is before a decision is made for quarantine at home, the public health inspector is directed by the medical officer of health. So a public health inspector, public health nurse will do what we call a home visit for assessment. And we look at the general outlay of the home. Is there a bathroom, for example, where that person, potential client, will need to use, because we do not want them to be sharing bedroom and bathroom in particular with other members of their family. We also go in the home, we teach them how to wear the mask. We educate them that at the end of 4 hours, they should be taking off the mask and changing the mask. We teach them how to wash their hands and how to use sanitizer on their hands. And we also teach them to clean areas that are commonly used.
Nurse, I really want to just extend my absolute appreciation to you. You have been really good, very clear. I know it's a lot of work, you and the team that you represent right across Jamaica. And on behalf of the Jamaican people, the Jamaican government, the Ministry of Health and Wellness, I want to just express our profound appreciation for your efforts and for the efforts of all others like you. Thank you very much for coming on. You volunteered to come on to give this information, and I hope that the purpose for which we planned and organized this, which was to give the public a better understanding, will result in greater cooperation by the public as we move into the community transmission phase. Thank you very much. Get some rest, please, and we continue to give all the support that you and your team requires and deserves. Thank you.
My pleasure. Have a good night. Bye-bye.
CMO, I wanted you to just give our listeners a little comment on what Nurse just said. I mean, That is a lot of work, and I think it's so important for us to understand the importance of this part of the efforts out there, and the public's participation is so critical. What's your take on the contact tracing?
Yes, thank you, Minister, and thank you to nurse who came on. The contact tracing is really the backbone of really dealing with outbreaks. And the team I know from Kingston and St. Andrew have had quite a bit of experience. Dr. Webster is here, who led the team in malaria, and that was quite in depth as well. But right across the country, we have several persons, several public health workers, including our public health nurses, our public health inspectors, our community health aides, and other groups of health workers have been engaged also in contact tracing. So right across the island, in almost every single parish, we have health workers that are on the field every day. They have very, very long hours. They come in late in the evening, and after they come in the evening, they have to sit down and they have to have their debriefing and they have to write their reports. So it doesn't just end with them going out and doing the contact tracing. They have a lot of work as well to do when they come in. And yet they do it and they get it done. So the work that we do at the ministry is dependent on all this information coming in on a daily basis. And so I want to say that we appreciate this extensive amount of work that is being done. We don't know if we're at the beginning or the middle of this outbreak, and so there's a lot more time ahead of us in continuing this work. And so I just want to encourage the healthcare workers. I just want to say that we depend on the work that you are doing, and you can clearly see that you are helping us in the managing of this outbreak and helping for us to keep our curve flat.
Thank you, CMO. And I just want to add to that, because before we go to our next interview, which I'm sure the public will find very interesting. This is a positive case that is asymptomatic. You know, the justification for contact tracing is containment. An individual who is either aware or unaware, more likely unaware, that they have COVID-19 in a community, in a household setting, could actually spreading the virus to all he or she may come in contact with, you know, family members, close friends, people they don't know because they take public transportation, you know, all just spreading, which creates clearly a major challenge for the public health system and for those individuals. If those individuals are vulnerable, they have comorbid conditions, they have hypertension, diabetes, they are, you know, senior citizens, compromised immune system. For all of those reasons, the contact tracing is absolutely critical, and the CMO is right. Clearly, I'm a layman in terms of medical science. I'm not a medical doctor, but I've come to discern as Minister of Health that our primary healthcare infrastructure and the work that our community public health officials do in the districts, in the lanes, in the communities, at the health centers is the fundamental backbone of our public health system. And our efforts to manage COVID-19 to date, to my mind, starts with them, because they are the ones who have been out there doing the work, as the nurse said, day and night, Saturdays and Sundays, public holidays, and we have to salute them. But more importantly, we need to give them all the support. And the community transmission that we speak of, which is now about to occur or is occurring, is going to require a lot more of it and a lot more cooperation from the public. So thanks again. We have online now another person who has agreed, and we really appreciate her for it, an individual who is a positive patient, and we'll call her patient G. And she is positive, but she's not ill in the terms of the symptoms of illness. and so don't, at this time anyway, require hospital care. And it's important that we explain that to the public, because you're going to have cases like these, and it is going to require a particular approach, more home approach than hospital approach. And as the virus spreads, we're going to have to find a way to manage that. So, patient G, are you on?
Yes, I am, ma'am.
Good evening to you. How are you?
I am well. I'm well, giving thanks.
Excellent. First of all, thank you very much for agreeing to come on. And obviously, we will keep it at patient G, and we won't give any other specific information. What we want is just your views on your experience, how you found out that you were positive. You don't have to call any names, any institution, just how you found out, what were your initial thoughts, what is your current condition, and just how you see yourself handling this particular virus.
Well, I was first quarantined when I got into the island, and I was put on the 14-day quarantine at home because I was by myself, so it wasn't a problem. But I found out from my first testing my temperature that I did have a temperature. I initially took 2 paracetamol and then test again, and the same thing. So I went that day, and during the course of the day, I started feeling unwell, very lethargic, couldn't even, make myself a meal. But because I didn't have the other symptoms, I didn't really think it was anything. I just thought it was something else, But on the second day, I was feeling worse, so I contacted the Ministry of Health and told them my symptoms, and then they came for me. That's where it started. Nobody else that I came in contact with, well, I didn't come in contact with anybody, so I didn't actually make any case, if you know what I mean.
Okay,
And
so your case, therefore, is an imported case. You came in with the virus.
Yes.
And you did have some symptoms.
Yeah, I had a temperature.
Temperature,
and yeah.
Okay.
And it was when it was discharged initially from hospital. I went home. I started short of the breath.
Okay.
And I had to go back in.
So how are you feeling now?
Oh, I'm feeling fine. I feel as if to say all is well, and I'm back to myself now and everything. So, yeah.
Okay. How long has that been, by the way, since you had to go and you found out that you were positive?
This has been about 5 weeks now.
Oh.
Overall, it's about 5 weeks since I've come and been in the different institutions.
So, how would you describe your experience in terms of the interaction with the doctors and the public health system?
What I can say is I'm glad that I was in Jamaica and it happened here, because I was treated well. I mean, I know it's a new thing and everybody, it's not like everything what to do, because it's like, and everybody presents differently, have different symptoms, So I understand that, but I can't complain about it. I give thanks I'm still here, and I appreciate it, and I think how it's been done, doing a good job. That's what I think.
Well, thank you very much for sharing your experience, and we are happy that you're feeling much better and that you're prepared to share. And the message from you, as I thank you as we leave you, is that...
the message from me is... Okay, you were saying?
No, I was saying the message from us is that we can overcome COVID-19. So once you follow the procedures, observe the instructions, then you can overcome it. Thanks a lot, and all the best to you.
And it's for everybody, and it's for I wish everybody would understand that this thing is serious, and moving around and putting other people at risk isn't the answer. If they could just follow procedure and just do what they're told, it will be over soon.
Thanks a lot.
Well, probably not soon, but this will pass.
Enjoy the rest of your evening.
Thank you very much.
Thank you. So this is a patient, listeners, that was positive, was imported, had some initial symptoms, had to interact with the public health infrastructure, and has since recovered. And again, we have announced that we have to date some 28 persons who have recovered, and we're going to have more. We're going to have more recoveries. We're going to have more persons who are infected, and it is for us to continue to work together in order to overcome the challenges associated with COVID-19. I'm not sure if do we have the other person online? Yes? Okay, so we have one other positive patient online, and no, having some difficulties. Yes? Okay, CMO, any thoughts on the treatment so far to date in terms of those patients that have been treated and have recovered? Any comments on that while we get the other asymptomatic patient?
I would want to say that what we have seen, our experience in Jamaica has been that the majority of the patients that we have seen have been with mild symptoms. We have had a few persons who have had moderate illness, and by moderate illness I mean that these are persons who might have been on oxygen for a while, or have been asthmatic, needed to be nebulized, and we've had a few patients who have been severely ill. So for the most part, we do see that it is a mild illness that we are experiencing. However, what I want to point out very, very clearly is that the persons that we've had moderate and severe illness in are the persons who we have seen from other areas, are persons who who have chronic illnesses, diabetes, hypertension, persons with respiratory illnesses, persons with kidney problems, persons with obesity, persons who are at the extreme of age, the elderly persons. These are the persons that are at high risk for severe illness, and this is borne out in what we have seen here as well. And so these are the persons that need to be protected in the population. The vast number of persons that we have now that are positive are going to be young persons, and many of these young persons are going to have very mild illnesses. We're not going to see the duration of illness that we see in the older person. We're not going to see the moderate to severe illness in most of these persons. Although, things are changing across the world, Minister, and we are seeing and emerging in some countries where we're seeing that more younger persons are being affected with severe illness. But so far, our younger persons have been doing pretty well. So right now, as I said, the vast majority of the patients the persons that are confirmed are in the younger age group, and we do expect to see a milder illness. However, who it is that they have at home, that is the important thing here, because many of these persons live with their parents, they live with grandparents, they live with other elderly relatives who have comorbid illnesses. So they're both elderly and they also have comorbid illnesses. And these young persons have to understand their responsibility. Not because I'm feeling well, I have to stop the transmission. I have to prevent the transmission from myself to somebody else within my home, or even the person that I may pass on the road, who I may have stopped and talk with for 15 minutes, who would be exposed to me for that kind of period, who may be elderly, who you don't know may have chronic illnesses. So we have to protect those persons from getting the illness, because these are the persons who will end up with more severe problems than the younger person.
Okay, thank you very much, CMO. And we're going to move right into a young person, someone in their 20s, who is positive, is asymptomatic, and who is now in isolation and would like to get her experience. I'll call her Patient X. Patient X, are you on?
Yes, I'm here.
Good evening to you.
Good evening to you as well.
Let me just thank you very much for volunteering to come on and to share your experience. We won't call your names or where you're from or anything like that. We just want to get your experience, how you found out you were positive, what you were required to do, and just generally what your thoughts are on this experience.
Okay, so well, I did a test at first, and they called some days afterwards and told me that I was positive. So they told me to isolate and don't go outside and always wear a mask and do the necessary precautions until they could send for me.
Okay.
So
and then,
right.
And then what happened after that? They came for you?
Yes, they came for me. I was taken to a hospital where my vitals were checked. And from there, we went to a facility.
Right. And how are you feeling?
I'm okay. There's no symptoms. I'm not coughing, no fever. I have no symptoms at all.
And this is how many days since you have been diagnosed or said to be positive?
From Monday. From last week, Monday.
Last week, Monday. So well over, just over a week. Well over a week.
Yes, yes.
Right.
And there's absolutely no symptoms.
So you feel just the same way you always feel?
Just the same. There's no difference.
Right. Just curious, how many people do you think you may have interacted with? Just numbers. It's the time when you, before you were tested, like the week leading up to or the days leading up to being tested. Would you say you interacted with 5 people, 10 people?
Yes, because I was still going to work and at home and so forth like that.
Right, and that's fine because guess what? You never knew you were
right,
positive.
I did not know.
So you were just living your life as a normal person going about your business.
Right, just as a normal person, not feeling ill or anything.
So you'll be going to your supermarket or store, you'll be stopping, taking public transport maybe and all of that, right?
Just a normal day, yes.
Right. And in terms of the others knowing about your status, is it public in where you're from, in your community, in your home? What?
Yes, it is. Yes, it is. Well, you know, as I tell all of them, I just want their prayers. That's all I want. For everything to go away and everybody can be okay and we have no more deaths, so we can go back to our normal lives. So that's all we really need.
And how have they treated with you in that setting?
Very bad, very bad.
Okay, tell me a little about that. I mean, people come to you and say something to you or what? Yeah.
Yes, it's like they behave like I am the one that created the virus, or they will probably say, me know about it and me did that spread it because me did want people for dead. How can I know about it when I was tested afterwards and I got the results? I'd have to wait until the results because, as I say, I'm not feeling any illness. And then we talk how me wicked and for dead, and you know them Jamaican persons are.
Right. So how did that make you feel? I mean, knowing that
I'm going to feel bad. I'm human. I feel bad like I did something wrong when I did nothing at all wrong. Sleepless nights, crying, praying that I don't infect anybody, or you know.
And some of these people are people you know, right?
Persons that I know, speak to on a daily basis.
Right. And once they hear, they just get cool on you.
Right, like I did something wrong, or I am the one that caused this on myself, when I was just somebody going to work just like a normal person.
Right. So what is the lesson out of this? Obviously we need to do a lot more as a people, as a government, as individuals, as citizens to really bring more clarity and attention to what COVID-19 is, and that people should not feel like, you know, as you said, they have brought it on themselves, that it is, it is their fault. it really is a virus slash a disease that has come up
Right.
on us, and we
They
have
have
to work
Jamaica saying, sickness make for everybody. So it doesn't choose who and who to affect.
Right. So how has that affected your own mental state? I mean, you say you're stressed out and sleepless
Right, at
nights.
first I was.
Yeah.
Sleepless night, crying, wondering why me, asking God why, you know. But then I just pray for him to give me strength to deal with this and just to heal everybody and the world and Jamaica, because we're just such a small country. All my friends as well that were positive, them going through even worse than what I'm going through. Persons are calling police on them as well, and I just pray for strength for everybody to deal with this.
Right. Well, that's very sad. You make me very sad tonight. Recognizing how much work so many persons have done in public health. We really have to do a lot more to get the society to understand and appreciate. And your testimonial is very important, because all of Jamaica needs to appreciate that none of us are all of us are susceptible, put it that way, to getting COVID-19. And indeed, the modeling that has been done by our epidemiology unit suggests that quite a number of Jamaicans are going to get it. But most of them are going to be in a similar position to you, in that you won't have any symptoms. You'll just be going about your way, and you may have one or two small things. You do a test, you're positive. The question is, what happens after that, so you can get rid of it and not infect others? And that's where I want to take you before you leave us. Having discovered it, told about it, how have you been treated by the authorities in terms of the management of the process to where you are now? And you don't need to say exactly where you are, but just give us a little.
Okay. As I said, they check your vital on a daily basis to ensure that you're fine. Ask questions, how are you feeling, if there's anything wrong. And they give you things to boost your immune system. Because remember that you have to have a strong immune system as well. So those are the things that they do. And we are very grateful for it as well.
And then, of course, you're taken out of the environment and placed in a situation that...
Yes, we're placed in a facility where we're treated.
Right. And you're comfortable there?
Yes, I'm very much comfortable. They're great staff members and... Right.
Right. And
we're very comfortable.
Okay, well, I'm very happy.
Checked on regularly to see if we're okay. Yes, we're quite fine.
So just use the opportunity to relax your brain and your mind and your body. And
That's what I'm doing.
Take it easy, because you soon get your 2 negative tests, and once you get that, then you're on your own and you can go back to your normal life. What is going to be important is that when you get back into your community, persons must see and treat with you like you are no different from any other person and what you be. And I hope that is something we have to spend some time on. All right, my final question to you is, what would you say to Jamaica and to Jamaicans in terms of your experience? What kind of advice or information would you give?
Just to get tested. Everybody just need to know if they have it, yes or no, and take the necessary precautions as well. And to mistreat persons that do have it, it's not a good feeling. We don't cause this on ourselves, and there's treatment out there. This is not a life and death situation. To be grateful that Jamaica has the least amount of deaths here, that's a great thing. And just pray. We just need prayer more than anything right now.
Very good. Thank you very much, Patient X. You've been really kind and brave and honest to come on and to give your account of what is happening. We in public health are always going to be here to give you the support, and others like you. And I know those listening on are going to better understand what an asymptomatic patient experience is. And also, you brought out very strongly the issue of discrimination at the community level, which is something we're going to have to do a lot more on. So thanks a lot. Enjoy the rest of your time in the facility and get well soon.
You're most welcome, and thank you. Thank you a lot. Have a great day.
All the best to you. CMO, talk to us a little about symptomatic and asymptomatic, because One of the concerns I have as a policymaker in health is that we're going to have to help the country to understand and transition from thinking that you have to be in a hospital when you have COVID to recognizing that most persons are going to have to deal with COVID from home. Tell us a little about that and why that is necessary and how that is going to have to happen in terms of we call it a protocol. You can say the new standards, if you will. And afterwards, I'm going to ask Dr. Webster to add to that.
Okay. Right. I think the first thing that we have to understand as Jamaicans is that this virus is new to the population. So we have no immunity. We don't have anything in our bodies that is fighting it as we would fight the flu or something else that we would have been exposed to before. So what it means is that once the virus start affecting a significant amount of persons, once we have a mass of persons that are infected, then it is going to pass through the population. I mean, our estimation was that we would have almost 2 million persons that are affected. And this is still so. So the virus will pass through the population. Many persons that are affected by the virus who have become infected from another person will have absolutely no symptoms. Many of them will not transmit the disease. They will remain asymptomatic and they will not transmit the disease. There are some persons who are going to have very mild symptoms, and even with those very, very mild symptoms, especially the young persons who may not even recognize the fact that they have symptoms because they're not coughing or they don't have any cold. They may just feel a little scratching at the back of their throat. They may wake up and the appetite is not the same. They may feel more sleepy than usual. They don't really consider themselves to be symptomatic. Okay, so as far as they're concerned, they're asymptomatic, but they're still able to transmit the virus. So what you're going to find is that it's in that pre-symptomatic phase, that those 3 days before you actually start having symptoms, when people appear that they don't have symptoms, but they may have very, very mild symptoms that they are transmitting. But the majority of persons, the majority of the transmission that is going to occur from persons who are having flu symptoms. They're coughing, they're sneezing, they probably have some upper respiratory symptoms, and they will have fever. Those persons are the persons that you're going to get the most of the transmission, and these are the persons that are going to drive the transmission through the population. However, once we start having the significant amount of persons that are affected, it means that we now have to consider that everybody is affected. So we have to manage ourselves as if every single soul around us is affected. And therefore, what do? We therefore have to now resort to our own personal protective equipment, our own adherence to infection prevention and control measures to prevent us from becoming ill. Now, I've said that the younger persons without chronic illnesses, are going to have no or mild symptoms. But they have to bear in mind that who is at home? We can't say it enough. Who are the elderly persons? Who are the at-risk persons in your home? Those are the persons that you really need to protect, because those are the persons that if they become ill, they're going to end up in hospital. Okay, they're going to end up in hospital, and then we don't know how they will progress from then on. So it really is about the personal measures you take, and then there are also some environmental issues that you have to look at. How it is that you clean and sanitize the areas that you work in, that you live in. You know, remembering that it's not just that it's transmitted by droplets, by somebody speaking and the droplets falling in your space so that you breathe them in, but also on the surfaces. Right? So if you're in a room, for example, let's talk about a pantry at a workplace or a restroom at a workplace. You don't know who was in there before you. Okay? And you don't know if they were coughing or they were sneezing. So you don't know what is on the surfaces that you're touching. You don't know what is on the door handles. You don't know what is on the elevator buttons that you're pushing, you know. So you have to take the necessary precautions, meaning washing your hands frequently, hand sanitizing frequently to prevent the transmission. You have to stop it yourself. The virus moves from person to person. You have to stop it. Right now, if it is that we have significant amount of transmission within our communities, we have to do our best to slow that transmission. To slow down that transmission, slow it down so that it don't reach the persons who are going to get the more severe illness. Slow it down so that it does not reach to a lot of people one time so that the health system have to deal with that. We know it's going to pass through the population and a lot of persons are going to be affected. What we don't want is that there is a lot of people affected one time and they place a burden on the health system that already has to respond to all the other illnesses that we have. And the fact is that even if I have 1,000 persons that are infected, and these are all 1,000 young persons who are healthy and are going to do well, for that mass of persons, there's always going to be a small percentage of those persons, small percentage of persons that are affected by those persons who are going to become severely ill. Okay? So that is what we have to try to prevent. And we can prevent it. We can prevent it by stopping and slowing the transmission, by just paying attention to those things that we need to do. We really have to understand that it lies in our hands. Every single individual has to take responsibility to stop the transmission of the virus.
Thank you very much, CMO. I think that's a great explanation as to what is happening. Dr. Webster Carr, epidemiologist, she's a lady, by the way, that's a big word. Just to explain it, she's a lady that tallies the numbers, assesses the direction of the numbers, manages the trends, makes the projections as to where we're headed, tell us what to do sometimes, even the stubborn ones like myself and the CMO. But really important role that she has as the person who really looks at the big picture by getting all the smaller contributors, the data. Dr. Webster Carr, tell us, and we're closing shortly, tell us your take on what we have experienced here, and in particular, where I really want Jamaica to focus. Community transmission, the asymptomatic cases, the home isolation, that kind of narrative, because we're going to have to place a lot more emphasis on that. Your take.
Thank you, Minister. So we have to look at what we're seeing now. We are seeing more and more cases that are coming up without links. So it is telling us that we are having more and more local transmission of cases, and the numbers are getting larger and larger. So there is obviously a signal going out to all of us what we are dealing with. And what we are seeing now is the effect of 2 weeks ago. So that we are even more today further along than we are picturing now. So can we need to imagine that and to say we have to do what we have to do now. And so we will see that effect in a week, 2, 3 weeks. So the important thing that CMO spoke about, we have to ensure that we protect ourselves and protect others, because the virus is being transmitted throughout the country. And so we can't say it enough. And just walking on the street, being in our offices, we are seeing the behavior. Persons are still sitting close to each other. We are still when we're talking to each other in each other's faces, we need to be conscious of what we are doing. And we are now advised about masks, how we are wearing masks. Everybody's touching their face, taking off the mask, putting it back on. That is very, very dangerous. Consciousness. We have to be very conscious of how we do what we do. How we interact with our family members is also important. We have to do the necessary physical distancing, especially for older persons and those who may have some underlying diseases. Matter of the persons, as we get more and more cases, we're going to have more and more persons at home, even though they're ill. We will not be able to take out everybody. So the importance of, in effect, isolating ourselves, whether or not we know we have COVID-19. If you are sick, have a fever, might be mild symptoms, you need to isolate yourself, which means that you're in a bedroom by yourself. Hopefully you can have a bathroom by yourself, but if not, the importance of cleaning and sanitizing the bathroom that may be used by more than one person. So to ensure that we be conscious of what we do as a country, as individuals, and to protect each other. So I think that's a mouthful for me.
Thank you very much, Dr. Webster-Carr. Just to summarize, and I really want to thank those who have come on and the public for listening, and those who have listened and understand what is being said, that they transmit that to their neighbors, family, friends, others who are willing to listen, because it's so important that we have an all-of-society approach to addressing this issue. A couple of key issues which I'm hoping we would have taken away from this. Firstly, that we're moving into another phase of the COVID-19 pandemic in Jamaica. We are moving now to what is described in clinical terms as community spread, which means that we will see more cases emerging in communities around the country that have no immediate link to someone who has traveled with the virus coming into Jamaica. It is expected, it is understood that it will happen, it is the way the virus works, and that is the case in all countries. So when you hear us say we have cases under investigation, which sometimes we put in the releases, it means that some cases don't have an immediate and obvious connection with an original person who traveled in. Remember, all cases are brought in, are imported, but after a while it becomes very difficult to determine when it came in and who brought it in. That would lead to someone having it. So it's important because the country needs to appreciate that over time the virus is going to move across the country and you're going to have more persons getting the virus. It is not an indication of failure on the part of the public health officials, on the part of the government, on the part of the country. It's just the way it works. The virus is highly contagious, very easy to pick up, as the CMO said earlier. You go into a public bathroom, you put your hand on the surface, somebody was there who coughed on it, you pick it up. You're talking to someone too close on a public transport, in the market, in a shopping center, in the supermarket, you pick it up because of the droplets. So it's very easy to pick up. And over time, a lot of people are going to pick it up. So we're moving in that phase now. And Jamaicans need to understand that, which is why they need to observe the measures that have been introduced, because we want to not make it too rapid. So in a sense, and I'm going to introduce a term here tonight that has to be dealt with very delicately. In a sense, we're moving in a phase that could be described with the efforts of public health as a managed spread. Managed spread meaning we want to slow down. We don't want it to spread too fast. We know it's going to spread anyway. over time, we don't want it too fast, because if it happens too fast, it means more persons are going to turn up in the hospitals where we don't have enough beds to treat them. And the catastrophe of that is manifested by just watching international news. You see it on the big newscasts where people are waiting in lines to get into a hospital, where people are dying at home because the hospitals don't have enough facilities. We are trying to prepare for that, which is why we're buying up new beds and ventilators. But if we don't manage the virus, then it could spread too fast, too quickly, and could be a real challenge for public health to respond. So that terminology of managed spread is something that Jamaicans are going to have to eventually adopt, recognize, and understand. And that's the community spread phase that the efforts of public health have to be working on. The second that I'd like as a takeaway is the issue of asymptomatic versus symptomatic. Clearly, symptomatic means you have symptoms. You cough, fever, respiratory issues, breathing problems. The more severe, the more requirement for hospital care. And we do hope that we have a minimal number of that. We have a projection as to how many we have. Some extremely severe, so you require high dependency or ICU, which is when you need the ventilator to help you breathe. That's the most severe. The persons who are most susceptible to that are persons who have underlying conditions, diabetes, hypertension, cancer recovering patient, cardiovascular disease, obese, overweight, that sort of thing. They will more than likely have a more difficult time with the virus because their immune system is compromised, which is why the caller said the asymptomatic person, they're boosting their immune system right now, so they're giving them the vitamins and so on, which is why exercise is good, which is why eating well is good, which is why boosting your system with your vitamin C, etc. is good. And I'm a layman, of course, and I'm watching the two doctors on either side. If they think I'm committing any breach in my prescription, please let me know. But if you are, the other is the asymptomatic person. And what the studies and the projections are saying is that the majority of persons who have the virus won't feel any symptoms. They are asymptomatic. They won't have the fever, the cold, the headache, and so on. Now, that could mean hundreds and thousands of us in Jamaica based on our population. And it's likely to mean that over time. So you won't need hospital care. And you won't have enough hospital beds to put people in hospital who are asymptomatic. The response to that, therefore, is that the country must come to terms with the reality that many will have the virus and will have to be treated at home. Take the medication, basic stuff that the doctor will tell you, or over the counter. I guess over time we'll have to inform people on that. Stay out of interacting with other persons. Continue to try and get your nutritious meals, but stay at home, rest until you get over the virus. And I'm saying to Jamaica, increasingly, expect persons living in your community, maybe in your household, who are positive for coronavirus, but not sufficiently ill to go to hospital, and we're going to have to put you in, you're going to have to recommend that you stay at home. And the final point I want to make before we close is around discrimination. If we assume, and it's a good assumption because it is based on fact, based on the projections, based on what happens in other countries, that most Jamaicans will be exposed at some point to the virus, it means that we are predetermining those of us who discriminate, that because that others will have it and we won't. And it's a very faulty assumption. It's a faulty assumption, even sometimes with our best of efforts, because the virus is of a particular nature where it will spread. In other words, today for me, tomorrow for you. That's very likely. We don't want it to happen, but it's likely. And so what we say to Jamaicans, you're really discriminating against yourself if you form an opinion that somehow the virus is only for certain people and not for you. It would be a very wrong assumption. So we ask Jamaicans, please, don't assume that persons who have the virus have brought it in, have created it, are somehow cursed, have somehow sinned, have somehow deserve it, have somehow are bringing a plague on your community or your household. None of us are immune to the virus. It started somewhere else, and it is now here. None of us must claim or think that we will exclusively escape and it is others' fault, somebody else's fault. We must treat each other in a way that almost assumes that tomorrow we're going to need the support of those who are so infected and impacted today. And we really need to cut the hate and work together as a country, as communities, to overcome. I really do not want to hear about any case of persons threatening people, abusing persons because they hear that they have the virus. And also for healthcare workers, we don't want to hear that we are also not cooperating with our healthcare workers. I want to take the opportunity to thank all of you for being on the program today. We have tried to make our press briefings a little different by informing and educating beyond the numbers, because we believe it is important. We believe we have a responsibility to get the country in tune with what coronavirus is, what it represents, and also create the hope of a tomorrow that allows us to manage the virus, because it will not leave us in a way that does not pose the risk that it poses now as a new virus, and allows us to move on and continue to live and enjoy our life as we know it. And this is why it was important for us to speak about community spread, speak about the non-discrimination, symptomatic and asymptomatic, home care, all very important. I want to just say thanks again to the healthcare professionals or contact tracers. The nurse was excellent in her testimony of what happens in contact tracing. It's a big job, and Jamaica now depends on public health and those personnel to deliver us from this virus in public education, in treatment, in investigation, in all that they do. And I really want to say thanks to them. I want to thank the Chief Medical Officer, the epidemiologists, and the teams that they represent, because they have a big team that shores them up. I want to thank the production guys here at Phase 3 for being a part of the organization, and of course our public relations team headed by Stephen, who helped to pull this together, and the Market Me crew, who are also here and have been an important part of what we do. Thank you very much, and until next time, where we will also discuss another critical topic around the coronavirus. I'm going to just ask you to look at the screen for a closing video that represents our healthcare heroes, one of whom you heard speak earlier today. Thank you very much. God bless.
My name is Charmaine O'Reilly. I'm the in-service education officer for KPH. Well, when I left St. Jude's High School in 1981, I always wanted to become a nurse. However, I embarked on a journey in the financial institution, and I stayed out there for a number of years. And at age 35, I decided to go to nursing school to fulfill my dream as a nurse. I studied at the Kingston School of Nursing. I attended Kingston School of Nursing between the year 1999 and completed 2002. However, at that time, I graduated with a diploma in nursing, so I went to the Northern Caribbean University to get a degree in nursing. Started my degree 2004 and completed same 2005. My biggest concern, knowing that it is in Jamaica now, is that I don't think persons are understanding the nature of the disease, and they are not taking the necessary steps to decrease the spread of the disease. The hospital have retrofitted the institution where we have an area. If we have persons under investigation, they are placed in that area. The accident and emergency area, which I am on call for 24 hours, 7 days a week, we have retrofitted the area where the flow is not the normal flow as it relates to training. That falls under my purview. I have created a video, and the video encompasses major areas that can tell persons or inform persons about COVID-19. It highlights areas how to maintain good hand hygiene and how to put on your personal protective equipment and how to remove it. The training that we do also speaks to just your general well-being. How do you address COVID-19? We are also in the process of doing major fitting for N95 masks for persons who will be working in close proximity to the patients. The training sessions that we have done for before COVID-19, we have trained about 97 persons. Since we have had our first case in Jamaica, which was March 10th, for the month of March, we have done sessions covering basically all categories of workers: nurses, doctors, ambulance drivers, patient care assistants. We covered 581 staff members, including the staff members we have at Linac at St. Joseph's Hospital. And for the month of April, now today is April the 8th, and we have covered about 54 persons so far in training. And as I said, the main area we look at is an overview of COVID-19. We look at hand hygiene and how to put on your personal protective equipment, which is PPE.
Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with a cold or flu-like symptoms. If you become ill, please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness.